Alright, so I've determined that my scene is safe. I have on the appropriate body substance isolation. My mechanism of injury is going to be a fall from approximately 40 feet. I've identified my patient and I have adequate resources. At this time, I would direct my first assistant to maintain cervical spine stabilization, and I'm going to move on to my primary assessment. I'm going to start by determining my general impression of the patient. Sir, my name is Ben Fontanilles. I'm here to help you. What seems to be the problem? So, my patient appears to be in his 40s. He is unconscious, unresponsive. At this point, I cannot determine his chief complaint. So I'm going to move on to his airway assessment. I can hear snoring coming from the patient's airway. So I'm going to direct my first assistant to perform a modified jaw thrust on the patient, and I'm going to insert an oral pharyngeal airway. The patient does accept the airway. So I'm going to move on to assessing the patient's breathing. I'm going to expose, inspect, and palpate the patient's chest. I notice that the patient's chest rise is very shallow, and I can see paradoxal movement on the patient's left side. Based on this, I'm going to now have my second assistant start ventilating the patient with positive pressure ventilation using a bag valve mask, with oxygen attached to 15 liters per minute. Next, I'm going to move on to assessing the patient's circulation. I'm going to expose the rest of the patient's body looking for any evidence of external hemorrhage. I do not see any signs of external hemorrhage, so I'm going to check the patient's voice. There is no blood on my gloved hands, so now I'm going to move on to checking the patient's pulse. The patient's pulse is present and it's rapid and thready. Now I'm going to assess the patient's skin color. His skin appears to be pale, it feels cool, and diaphoretic. I'm going to determine that this patient is a high priority for transport. I'm going to provide a verbal report to incoming EMS units. I have a male who appears to be in his 40s. He's unconscious, unresponsive. Presently, his airway is being managed manually, and his breathing is being assisted via artificial ventilation. Now I'm going to move on to my secondary assessment. I would attempt to obtain a sample history from this patient, but unfortunately he's unresponsive, so I'm not going to be able to accomplish that. So I'm going to move on to my head-to-toe exam. Alright, I'm going to start by assessing the patient's head. I'm going to inspect and palpate the scalp. Now I'm going to inspect and palpate his facial bones. I'm going to look in his ears. I'm going to check his eyes. His nose. And his mouth. Now I'm going to inspect his neck. His trachea appears to be midline. I do not notice any jugular vein distension, and I don't feel any deformities to his cervical vertebrae. So I'm going to move on to his chest. I'm going to inspect, palpate, and auscultate the patient's chest. The patient's chest rise is adequate with assisted ventilations. I still see a paradoxal movement on the left side, and now I see bruising in that area as well. I'm going to move on to checking the patient's abdominal pelvic region. I can see some bruising starting to appear around the patient's umbilicus. His pelvis is intact, and his genitalia appears to be intact as well. Now I'm going to move on to assessing the patient's extremities, starting with his right side. Pulse is present. No motor or sensory response. 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 Now I'm going to check the patient's posterior. With the help of my assistant, on the head's count of 3, I'm going to roll the patient to his uninjured side. I'm going to inspect his thorax, lumbar, and buttocks region by using inspection and palpation. On the head's count of 3, I'm going to roll the patient back. At this point, I don't notice any secondary wounds or injuries that need management presently, so I'm going to move on to assessing my patient's vital signs, starting with his pulse. The patient's pulse is going to be 72 and regular. For the scenario, the patient's pulse is going to be 110, rapid, thready, and regular. Now I'm going to move on to assessing the patient's blood pressure. My patient's blood pressure is 130/82. For the scenario, it's going to be 90/50. Finally, I'm going to assess the patient's respirations. The patient's respirations are 12 and regular with assisted ventilations. The patient's skin color is still pale, and still feels cool and diaphoretic. So for this patient, I'm going to assume that he's suffering from shock, so I'm going to treat him for shock. I'm going to continue assisting his ventilations with high flow oxygen. I'm going to keep him warm, consider elevating his feet, and rapid transport to the hospital. Based on the fact that I think this patient's unstable, I'm going to reassess him every 5 minutes, and I'm going to provide a verbal report to the incoming EMS units. I have a 40-year-old male who is unconscious, unresponsive, fell approximately 40 feet. His airway is currently being managed manually. His breathing is currently being managed through artificial ventilation, and I'm treating him for shock. And that would be it for this station. All right, so I've determined that my scene is safe. Stop! Oh, it's not an accident. All right, so that brings us to our next point. All phones on vibrate, please. Including our soon-to-be replaced instructor. All right, so I've determined that my scene is safe. I have on the appropriate body substance isolation. My mechanism of injury is going to be a fall from approximately 40 feet. I've identified one patient. I believe my resources are adequate. And at this time, I would have my first assistant. What was that?
Don't even look at me. I was right here by my life.
What do you mean my assistants were imaginary? What do you think was holding the head? What do you think, it's magic? You think it's the power of positive thought? Maybe you're imaginary. Get out of here.